and focusing on the fundamentals of public health really had a head start in the sense that they were able to formulate a plan, get organized, take this very, very seriously, and really, really act quickly. But the other thing that the Director General said today was that it's not too late to turn it around. So even countries that didn't do that, even countries that didn't have that first-hand experience with SARS, have experience now with COVID-19. And it isn't too late to turn it around. It isn't too late to get the infrastructure in place to work on that and to use it appropriately. Many countries are going through very difficult periods of time. Some countries who have had success in suppressing transmission, who are opening up now, may have a setback, may have to implement interventions again, may have to implement these so-called lockdowns again. We hope not. We hope that we won't have to go into widespread lockdown again. So it's not too late to act fast. It's not too late to use the tools that we have. And countries have tools. They have surveillance in place. They have testing that is in place. They have people who could do contact tracing. Even in situations that are overwhelmed, break down the problem, break down this seemingly overwhelming problem into smaller components that you can tackle. And the reason we say this over and over again is because we have seen countries that have been in overwhelming situations who have turned this around. So it isn't too late. It isn't too late to use this comprehensive approach. We are here. WHO is here for all countries all over the world.
Okay, we're running out of time, but we've got time for two more questions. I call now on Simon Ateba, our friend from Africa News Today. Simon, unmute yourself and please go ahead.
Can you hear me?
Yes, Simon, please go ahead.
Okay, thank you for taking my question. My name is Simon Ateba from Today News Africa in Washington, D.C. As the number of cases in Africa continues to increase, we have like 400,000 people who have been infected so far, and over 10,000 fatalities have been recorded. We are beginning to see many people claiming that they have a way of curing the disease using non-traditional methods. For instance, on Monday, a very popular pastor in Nigeria, TB Joshua, released a video of a medical doctor in Cameroon who was said to have been cured of the virus through prayers. I was wondering, in the context of infodemics, how does WHO react to this influx of information coming from non-traditional sources and from pastors and from people who are not maybe in the medical field claiming that they have a way of curing the disease? Thank you.
Yeah, it's important we make the distinction between claims of disease cure and good acts that support communities in terms of the suffering they go through. And certainly spiritual leadership at a time like this is very important in communities, whatever the faith. And therefore we respect and have worked very closely with faith-based organizations on the huge contribution they are and can make to managing anxieties at community level, providing direct support to communities coping with this disease, dealing with bereaved families and individuals. So the role that faith-based organizations play is very important. They also play a very important role in getting good information to people. Sometimes it's projected as a route of misinformation. In fact, we find that faith-based organizations are a very effective way of passing good information because faith-based organizations are very often trusted by communities. They're a different channel, and we're working very, very closely with those organizations around the world. In fact, this week at the pre-conference on the WHO Infodemiology Conference, I think we had over more than 10,000 connections to that conference. In fact, I think today on the research side we have 1,000 connections into that. So you can see there's a massive hunger and there's a massive commitment to the positive management of information around this pandemic. And we're working very hard with our partners in the tech industry, our partners in the communications and social sciences, and other UN organizations to do that. So faith-based organizations are a very important part of this response. With regard to to claims of traditional methods or healing, we've seen that traditional, in many different diseases, effective therapies have been found through the examination of traditional products and other things. There are products out there that can enhance health and well-being, and obviously we should healthy diet and supplementing our diet with appropriate products is a very important part of being healthy. Specifically though, when it comes to making claims around cures for products, we have to be very, very careful. We want to make sure that all products that show promise in the care or cure of individuals with COVID-19 go through and go into properly managed trials so we can see what their impact and their effectiveness is. It is impossible to determine the effectiveness of any drug or any traditional product unless we are put it through the rigors of a properly controlled trial. That is the same whether it's a product developed by the pharmaceutical industry or a product developed by traditional methods. As I said, many drugs and many effective things have been found through traditional approaches. So traditional medicine is very important to communities around the world, and therefore WHO has an initiative on traditional medicine. We look on traditional medicine in a very, very, very positive way. But it is also, as I said, extremely important that any promising therapy go through the proper testing for safety and efficacy so we can all support such products if they are found to be effective. Maria?
Just quickly to add on the information. So as you've pointed out, there's a huge amount of information that's out there, not only for COVID, but for different cures or for every element of this pandemic. And as Mike has said, we have a conference that's ongoing right now on this infodemiology of how do we manage all of this information. We're not set up to absorb this much information all the time. So how do we tease out the good information from the misinformation, from the disinformation? Because there's information that's out there that's not quite right, and it needs to be corrected. And so we work very hard with different platforms. We put out these Mythbusters where we directly head-on say, this one isn't quite right, this is wrong, here's the right information. But there's also information that's out there that's willingly wrong. And that could be incredibly dangerous, and it could put people in harm's way. And so we're working also to ensure that the information that's out there that is not harmful, and that anything that's out there that is purposefully wrong, we address. Faith-based leaders are incredibly important in this, and as Mike has said, we work with faith-based leaders across the globe. We work with different travel and tourism industries. We work with the civil sector. We work with scientists and public health professionals. We work with journalists. Journalists also have a role to play in getting good information out, having fair and balanced reports, and we're so grateful for these articles that come out that explain very complex topics and put it into the context of how we can help people suppress transmission and save lives. So we welcome the partnership with journalists on that. And we work with individuals. Everyone on the planet is part of this response. Every single person. And everyone needs to know that they have a role to play in this, not only from protecting themselves from getting infected, but preventing the onward transmission to their loved ones, to someone who potentially is vulnerable that could develop severe disease. So you have a role to play in also not ensuring that you don't pass on poor information. Go to good sources. You can always come to WHO, but there are ministries of health, there are hotlines, there are reliable sources of information. So please choose your information carefully, and please be conscious about the information that you pass onwards.
Maybe I would like to add on this issue. I remember this is during the HIV/AIDS era at its peak, and we started using medicines, and some patients were using some medicines, and there was same situation like what we're seeing now, where people were forced to choose between the medicine and faith. And I remember religious leaders, we discussed with religious leaders, and religious leaders going to their followers saying, the two can go together. Have your faith, continue to take your medicine. That's what we advise you. And that really resolved the situation. And we know, as what Mike said, many religious leaders who would really advise their followers to follow their faith, but at the same time use science. The two do not contradict, they go together. So that's our advice, and we would call on all religious leaders to be in this fight and save lives. Thank you.
Thank you, Dr. Tedros. And the very last question goes to Paulina Alcazar from Encadena News, Mexico. Paulina, can you unmute yourself and go ahead?
Yes, thank you. Can you hear me?
Very, very well. Please go ahead.
Okay, thank you for taking my question. Greetings from Cancun, Mexico. As Dr. Tedros says, this virus is very quick, and thanks to the contact tracing, we know that more and more people are infected without symptoms, the so-called asymptomatics. Can this be due to taking more than 4 months in raising their immune system throughout food, vitamins, care? Do you know, do you have new records of this condition?
Can you repeat that? We couldn't quite understand. You mentioned a condition related to the immune system. Is that correct? Would you kindly repeat it?
Yes, thank you to the contact tracing, we know that more and more people are infected without symptoms, the so-called asymptomatics. Can this be due to the people taking more than 4 months, they raise up their immune system by foods, taking care of their own?
So you're asking whether people have improved their immune system by particular foods? Is that? Do I understand you correctly?
Lo puedo hacer en español.
I can ask this question in Spanish if that's possible. Thank you very much. Dr. Tedros is saying that this virus is circulating extremely quickly, and thanks to contact tracing, we have been able to find more and more people that are asymptomatic. These people do not have any symptoms. Could this be due to having taken care of themselves for 4 years, for having improved, strengthened, bolstered their immune system through healthy eating, through doing exercise? Do you have any information about this? Do you have any information regarding the asymptomatic people that perhaps have boosted their immune system through healthy living? Thank you.
So I can start. Maybe Mike would like to. If I understand that the question is, it's more about why are we seeing more of these asymptomatic cases through the contact tracing, and are they doing something differently? We do know that through contact tracing and people who are under medical observation, some of them are being tested and they're testing positive and they don't have symptoms. And we've known this for quite some time, that you can have people that test positive that don't have symptoms, and we know that those individuals, if they're not in quarantine, they can pass the virus to someone else. What we tend to see through surveillance activities is normally surveillance is focused on people who show up in a health facility, especially in the beginning of an outbreak. Certainly in the beginning of the pandemic, we often found people who were symptomatic first. And then when we did our contact tracing, if we found that that individual passed to someone else, they tended to, the secondary transmission, those individuals tended to have more mild infection, some of them being asymptomatic. We don't know why in terms of their immune system or if they were had anything to do with how they ate. What we know is that all people are susceptible to this virus and people can get infected. And we know that it's very important when we do our case finding and our contact tracing that those initial cases are isolated and they're cared for depending on the severity of their illness, and those people who are undergoing contact tracing are in quarantine, because in essence, if they in fact are infected, then they are not able to pass that virus to someone else.
I think in general we don't understand the factors that drive asymptomatic versus symptomatic transmission. We don't know whether that is related to dose, related to age, related to the health of the immune system. But I think regardless of that, I think it's important that as human beings, we're a very complex biologic system, and we need a healthy immune system. We go through many infectious diseases throughout our lifetimes, and therefore a healthy immune system, a healthy microbiome, having general health is very important in fighting disease, and therefore while it doesn't specifically help for COVID-19, a healthy diet and being in generally healthy condition and protecting and promoting immune health is very positive for any number of infectious diseases. So I think it is important. Good nutrition leads to better immune systems. We've seen that. We've seen children who are undernourished, children in refugee camps around the world, and how they succumb so quickly to acute respiratory infection, to the impact of measles and other diseases. So we do see the vulnerabilities that are created by poor nutrition and undernutrition around the world. And we've seen the impacts of stress. You put a human being into a situation where they don't have access to adequate hydration, adequate diet over a prolonged period of time, where they're subject to psychological stress. And the archetype for that are the millions and millions of refugees around the world and migrants who live in these sorts of conditions. Absolutely, people in that situation are more susceptible to infectious disease, and I think it's, as a general principle, we all need to look to how we can create a healthier population. This is what Dr. Tedros speaks about in the 3 pillars of WHO strategy. We're not just talking about responding to epidemics. We're talking about protecting health, healthier lives. We're talking about healthier and stronger health systems to deliver healthcare, and we're talking about protecting the world against emergencies. So a huge chunk of WHO's overall strategy in our program of work for the next 5 years is built around the principle of healthier lives. And the immune system is an extremely important component of that, and nutrition is linked to that in a very meaningful way.
Thank you, Dr. Ryan, Dr. Van Kerkhove, and thank you to all the journalists who attended and for these really good questions. We will send the audio files as always. And thank you, Dr. Brennan, for being on the line and answering questions as well. I'll hand over to Dr. Tedros for final word.
Yeah, thank you. Thank you, Margaret, and a very good start. This is not your first time, actually. We had you before to moderate this. So thank you to all also for joining, and especially to our colleagues from EMRO, Ahmed and Rick. Nice to see you virtually, and thank you for joining. And thank you also to all journalists who have joined today, and others, of course. And see you on Friday. Thank you.